Hi guys, so I thought it might be useful to give you an understanding of a basic CBT formulation that we use. This formulation is used typically in treatment sessions 1 or 2, or maybe if you get through your assessment pretty quickly, it may be done at the end of your assessment. So, a little bit about me. My name's Sandra Brown. I am a cognitive behavioural therapist. I worked in the NHS for 7 years as a low intensity therapist, trainer, and supervisor. And I now run a private cognitive behavioural therapy practice called El Sali CBT. So I do hope that you find this video useful if you're following along. I will try to take it slow, but obviously you can pause or rewind or rewatch the video, whatever you need to do as we move through this together. So in case you jumped straight to the video and you haven't had a chance to have a look around the website yet, here's just a little bit of information about what CBT is and isn't. So CBT is the type of therapy that can be used to treat a range of mental health problems, including anxiety, depression, and other conditions. It works by helping you to understand how your thoughts, feelings, and behaviors are all interconnected and how you can change those patterns to improve your mental health. It is a powerful combination of cognitive therapy and behavioral therapy techniques. And on our website, we do explain a little bit about how those two things came together. So a key thing for you to remember here is that CBT, although it does come under the umbrella of talking therapies, it is different to counselling. CBT is more active than counselling in the sense that you'll be doing task activities throughout treatment, sometimes with your therapist, sometimes on your own. In a homework task, there are homework tasks and they are important in CBT because they help you to embed the learning that you're doing in your therapy sessions. But they also help to gather information about what's going on for you, information that might not even be apparent to you at first. So you might be gathering evidence, keeping diaries, doing controlled experiments, or anything else that you and your therapist think would be helpful for your recovery, really. So in that sense, CBT is a talking therapy, but it is also a doing therapy. So, in terms of goal setting in CBT, typically at the start of treatment, you'll set some goals with your therapist, and those goals would be SMART goals. So, they'll be specific, measurable, achievable, realistic, and time specific. When you've set the goals with your therapist, they help to not only keep the therapy on track, but also at the end of treatment, you'll revisit those goals with your therapist to make sure that you have achieved those goals or you're comfortable with the progress that you've made in terms of those goals. This ensures that the therapy stays focused and that the outcomes are realistic and therapy has an endpoint. Both the individual sessions and the number of overall sessions are time limited. The point of CBT is that you become your own therapist and you're able to manage your mental health without therapy. This could happen in 6 sessions, it could happen in 20 sessions. It just depends on what the specific problem is that you're experiencing, or if you've got several things that you're working on, you may need more sessions. CBT is heavily evidence-based and it is one of the most researched types of therapy there are. And there is evidence base for every single technique that you learn in CBT. And CBT is suitable for most types of common mental health concerns. So let's jump in and have a look now at the basic formulation.
So if you've been playing around in the website, you may have seen a 5 areas model. It has been on our overview pages, and it's just to give you a bit of an understanding as to how any situation or event can trigger the thoughts, physical symptoms, behaviours, or emotions associated with whatever difficulty it is you're experiencing. So in CBT, this is one of our basic formulations, and we usually do this just after the assessment. So session 1, session 2, you'll usually go through this type of formulation. You may then move on to a much bigger formulation, but this is the basic understanding of how your disorder is affecting you.
If you are following along, you can use your sheet now, or you might choose to watch the video first and then fill in the sheet later. The sheet can be found just to the right of the video on the website. So this is a commonly used basic formulation in CBT. It has different names. This one is the 5 aspects model, but it is also called the 5 areas model, or it's sometimes referred to as the hot cross bun. The arrows here show that wherever you are on the model, everything is interconnected. So your thoughts are connected to your emotions, to your behaviours, to your bodily sensations. And the trigger triggers off this cycle. Usually the way that the trigger activates the cycle is that the thought is activated whenever there's a trigger present, and then that leads to an emotion or a bodily sensation or a behaviour. Even if at first the thought isn't recognised, so you might experience the emotion first, you might experience the bodily sensation first, but usually it is a thought that is triggering off the cycle. CBT can help you to work backwards towards the thought. So it can help you to, if you have experienced an emotion first or bodily sensation first, CBT can help you to work backwards to figure out what the thought is that might be triggering that off. And the point of that is that you would be able to intercept the cycle and change the negative association or the negative cycle that's happening for you. So sometimes the quickest and easiest way for us to work on this cycle is actually to work on the behaviours first. And that is because although you may not be able to recognise the thoughts that are coming to you at the time that the trigger is happening, you will be probably fully aware of what your behaviours are in that situation. And as I said, sometimes it's really difficult for people to work out what their emotions are and what their bodily sensations are, as well as the thoughts. So typically with something like anxiety, we might see that bodily sensations are really apparent, but sometimes with other disorders, bodily sensations might not be so apparent. So it is easier for you to work out what it is you did in the situation and change that than it is for you to work on any other area first. So we're going to take a look at each of these now. If you are following along, then you can use your own situation to fill in each of the sections. But for this example, we're just going to use a fear of driving after a road traffic accident. It's something that most people can relate to, so it should be a good example for us to work through in this formulation. So we're here in the trigger section, which is where we set the scene for what's happening to you. The trigger is asking about the situation, but it's not just any situation that's going on, it's the situation at the time that the cycle was activated. So what we want to know here is what is happening during that time when this trigger is being activated. So we're asking where, when, who are you with, what happened, and how did it happen to you? Context is really, really key here. Without context, we get pretty useless information and not very much to work with. So if we have a look at an example of that, we can see here that without any context, we might get anywhere, anytime, anyone, getting very anxious whenever I have to drive. This isn't giving us very much to work with. So what we want to try and figure out is what is happening specifically at the time when this trigger is being activated. And it might be helpful to think of that in terms of where you were the last time this happened or what you were doing the last time this happened. So if you think back to the last couple of times that this trigger activated the cycle, what was going on at that time, and then we might get some more useful information. So this person has said that she was at home yesterday with her husband. She needed to go to the supermarket, but she started to feel anxious, sweaty, shaky, and she just couldn't do it. So here I've color coded this for you so you can see a little bit more clearly that most of what we've asked for in the trigger is covered here. So where was she when it happened? She was at home. When? Yesterday. Who were you with? I was with my husband. What happened? Needed to go to the supermarket, but and then how it started. She started to feel anxious, sweaty, shaky, and she couldn't do it. So if we continue asking a few more questions in terms of the trigger, we might get a little bit more information. So a good question to ask also might be the first time that this happened. And here we get a bit more information. So she was at home after the accident. She was alone. She wanted to go and see her mum, but when she got into the car to go see her mum, she felt too scared to drive. And she thinks that this was the first time that she had a panic attack. So if we take a look at thoughts and images, we're wanting to know what's happening in terms of the thoughts when the trigger is activated, what's going through your mind, what disturbed you about it. If you had thoughts, images, memories, what did that say or mean about you or the situation? This is really helpful information for us. It not only helps us to work out what's going on in any given situation that you're finding difficult, but it also helps us to work out what the disorder might be that you're experiencing. Thoughts are not always apparent to people, and so you may be asked to carry a thought diary and just kind of record what's going on in your day-to-day life, paying particular attention to any thoughts that trigger off really difficult emotions for you or trigger off any anxiety. Then that's a thought that you'd probably want to write down and keep a record of. So for this lady, she was scared. Her thoughts were, I'm scared. What if it happens again? Why is my heart racing so bad? What if I'm having a heart attack? I can't do this. I'm going crazy. And we can start to get a sense of what meaning she's placing on the situation. When she says things like, I can't do this or I'm going crazy, this has given us an understanding of how she feels about what's going on for her. So for this lady, she's also experiencing some imagery. When she gets behind the wheel of her car, she's seeing brake lights in front of her. This is probably linked to whatever happened during the accident or the time of the incident, and potentially maybe she hit the person in front of her, and so she remembers seeing brake lights from the car in front of her. But again, giving us some really useful information about what might be going on for her. So if we move on to moods and emotions, we start to get a sense of what emotion somebody is experiencing in this situation and outside of the situation, and what's happening to them emotionally because of this trigger being activated. So we start asking questions to get a sense of how this person is feeling. The language of emotions is really important. We usually find that people are tempted to put thoughts here. So they might say, I thought I was going crazy, which is quite common thought with anxiety, but it is not an emotion. Emotions are usually one word to describe how you feel. Emotions are rated out of 100, with 100 being the most intense feeling imaginable. So we can see that for this person, she's feeling sadness 80%, fear 100%, angry after the event 50%, embarrassed 60%, and frustrated 90%. So she's got some fairly high emotions, fear obviously being the highest here. Her frustration about the situation is also fairly high, and sadness is pretty high as well. One of her goals might be that she'd like to reduce the intensity of these feelings to 30% or below by the end of treatment. And we could certainly understand why she feels that she's had a panic attack if her fear level was at 100%. So now we're really keen to find out what this person does when she is experiencing this anxiety. So what helped her to cope? What helped her to get through it? Or if she didn't get through it, what was it that she did instead? What would other people have seen her doing? We want to know what her automatic reactions are. Context is still important here, but we might broaden the context now to include not only the last time this happened or the first time this happened, but also any other time that this has happened. This will give us some really useful information because we'll come to find out what this person is doing to feel safe and whether or not what they're doing to feel safe is having a negative impact on the cycle. So we can see, for example, that she avoids driving altogether and she's getting her husband to drive everywhere she needs to be because this is feeling safer. Not completely safe because she's still saying that she's anxious even when her husband drives and she's gripping the door handle. An interesting one is that she is becoming anxious being at home on her own. And sometimes we see this with anxiety where it starts to extend into other areas of your life. Sometimes the reason isn't obvious, but sometimes it is sort of pretty apparent that, for her, for example, if she's been having panic attacks, then she might be having the thought that, well, if I have a panic attack and I'm at home on my own, there's going to be nobody there to help me, nobody to kind of call for help. Some safety behaviours are discreet, such as drinking water when you feel anxious, or chewing gum, or driving, but only in the slow lane, or avoiding certain roads. These would all be safety behaviours just the same, and they are feeding an instruction to your brain that you need to do this behaviour in order to feel safe. Sometimes a person isn't aware of all their safety behaviours until they start working on the problem and gathering more information, and a qualified CBT therapist can help you to figure this out. So I've helpfully put here some information that we would actually put into the cycle. So you probably wouldn't want to write out kind of all of these sentences. So we just kind of shorten things down, just as long as we know kind of what is going on in terms of the behaviours, and as long as you know from kind of looking at that cycle what's happening when you get into these situations and what you're doing or not doing, then it's fine to just abbreviate. So we've just got here: leaving situation, avoiding driving, asking husband to drive, gripping the door handle, or avoiding being at home alone. Move on to bodily sensations or physical sensations. What did you notice in your body? What did you feel? Where did you feel it in your body? This one is usually one of the easiest for people to complete it, particularly with anxiety. It's usually the physical symptoms that would cause somebody to seek treatment with anxiety. These symptoms are clearly, indicating anxiety in terms of what she's saying here. Her heart was racing, she was sweating, shaking, crying. She couldn't think straight, she couldn't breathe, her stomach was in knots, and she had nausea. We might go on to ask a few more questions to decide whether this is panic disorder or not. Things like how often this happens, how quickly her symptoms appear, how long it takes for the symptoms to disappear. Again, a qualified therapist can help you with a working diagnosis based on this formulation. So if you are following along, this is where the 5 aspects model ends, but there is a little bit more that I would like to show you that is covered during your assessment with a CBT therapist. So let's move on to having a look at this formulation in its entirety, and then we'll cover a couple more things. So if we have a look at the overall formulation that we've just completed for this lady, we can get a sense of what's going on for her. So when she's wanting to drive anywhere, it seems that she's becoming quite anxious. She's getting sweaty and shaky. She's having thoughts that she's scared. She's having the physical sensations, her heart's racing. She can't breathe, her stomach's in knots. and then she is leaving the situation and her fear level is at 100%. That's going to feed back into the cycle. So then we start to see thoughts like, I'm going crazy, I can't do this. And that's obviously causing more physical sensations, more shaking, crying, sweating. And then her behaviour has now become to avoid driving altogether. And that's creating sadness, frustration, feelings of embarrassment in her. So you can sort of see how she's just kind of going around this cycle. And if she came to see a CBT therapist, one of the things that we would start to have a look at is changing what she's doing in that situation. So instead of leaving the situation and feeding information back to the brain that the situation is not safe, we would start to put a plan together where we can start to expose her to the situation. So starting to get behind the wheel of a car again, starting to drive again. She might start to drive on quiet streets first, she needs to stay in this situation until her anxiety actually reduces. And this is to help her brain to get the message that actually everything's okay, it's probably safe to drive, and she's probably going to make it back to her house absolutely fine. When she starts to work on the behaviors and she's starting to get the message that actually it's okay and I'm no more at risk than I was before the accident, then we'll start to work on the thoughts that she's having. So the thoughts that she's going crazy, or the thoughts that she's not able to do this. And then, of course, we would have picked up some evidence from her behavioural experiments that she has been able to get behind the wheel of a car, that she has been able to drive even when she's been feeling anxious. In turn, this is going to reduce the physical sensations that she's experiencing as she starts to be able to drive more and more places, and her brain gets that message that actually she's probably going to be okay. Then her body won't be wanting to trigger the alarm, so she won't get the heart racing, the sweating, the shaking, and she'll start to feel a lot better. And this obviously in turn is going to impact positively on her emotions, that she's not going to have to feel sad because she can't drive anywhere on her own. Her embarrassment will start to go down. Her fear level's already going down because she's not having those physical sensations, and she's just going to be generally less frustrated and angry with the whole situation. So I hope that that has given you a little bit of insight into how we do the 5 areas model. If you need to go back and re-watch the video to help you to work through this cycle on your own, then absolutely fine. You can watch it as many times as you need to in order to get this cycle down for yourself if there's something that you're experiencing. Obviously, you can contact us at Elsali CBT and would be happy to have a chat with you about what's going on for you. All you need to do is go onto the website and book an assessment, or you can give us a call, or you can send us a WhatsApp. However you need to get in touch is absolutely fine, and we'll arrange an assessment for you where we can go through this together. As I said before, there are a couple more things that I just want to show you, and this is one of them. So we would also want to know about how all of this is impacting on your life. So we might ask about different areas that are being impacted on, and how those areas are being impacted. So if we use the lady from the example that we've been talking about, she said that her relationships are impacted. She lives in a village and it's not easy to get around. She's basically housebound without her husband and he's getting pretty fed up. She's also said that social leisure activities, so the activities that she would do with other people, are also impacted. She's having to avoid seeing her friends, partly because she's embarrassed about what's going on for her. And also in terms of work, her husband's been taking her to work, but sometimes she's late because she needs to psych herself up before she gets into the car. She doesn't feel like herself, and she's starting to worry that she's just going to have to give up driving altogether. Obviously, this is going to have a massive impact on every area of her life, especially work. And this is the second thing that I wanted to show you. So the problem statement and goals. This is a really important area in CBT. So with all of the information that you've been gathering, you and your therapist will want to develop a problem statement usually. The statement encompasses the 5 aspects that we've just talked about and the impact that this is having on your life at the moment. So we take the most important part of each of the sections to build the statement. So if I give you an example of a problem statement here, for this lady, my main problem is that I am scared of driving, I get heart palpitations, and I think I'm going to have a heart attack. I'm avoiding driving now, which is making me feel sad and angry. As a result, I haven't been able to see my friends. Then we go on to set some goals with this lady, or with you. If you come to therapy, the next stage would be to set some goals for therapy. In terms of goals, we do make sure that they are SMART goals. So I did mention earlier that SMART goals are specific, measurable, achievable, realistic, and time limited. Bearing that in mind, we might have some goals that look a little bit like this. So for this lady, her first goal is that she'd like to drive to her friend Carla's house for lunch and drive back on her own by the end of treatment. That she would like to drive herself to work and back on her own by the end of treatment. And that she would like to reduce her fear of driving to 20% or less during treatment. This is just an example of goals. For example, her goals may have been completely based on the emotions that she was experiencing and reducing those emotions, but these are some pretty good goals. She's got some behaviours that she would like to work on. Goals should be behavioural. So even if, for example, somebody said to us, I'd really like to reduce my fear level from 100% to 20%, that's absolutely fine. But then what would you be doing differently if you weren't afraid? Well, obviously for this lady, she would be driving. So driving should be the goal. So that's it from me. I'm Sandra Brown, CBT therapist and director at El Sali CBT. I hope you have a bit of an insight into the most basic formulation we use in CBT. If you have followed along, then I hope that this was really helpful for you. If you would like support with something that's impacting your mental health, then book an assessment with us to see how we can help you. As always, please be kind to yourself. Take care. Bye-bye.